Hello, good day. This is Rayleigh Cabazor. I'm presenting my Unit 6 assignment entitled Nurse Educator Strategic Plan Presentation. Teachers and preceptors matter to nursing students and new graduates learning, and that their success can be attributed to the impact of how nurse educators influence their academic and clinical learning. The faculty-student interaction is a crucial factor in promoting learners' success, in particular among those learners who are most in need of support, such as first-generation nursing students. I have been a nurse for almost 20 years. More than half of my experience is taking care of the patient and training new nurses in the medical surgical field. The first few years were challenging for me in the molding of novice nurses into their new role. I thought my extensive clinical experience in the medical surgical field would be enough to help me teach these new nurses in transitioning into the clinical role. But I have noticed that the majority of nurses I've trained will need refocusing about how to be professional and how they are unprepared for assuming the role of the clinical nurse. So while still working in a clinical setting, I decided to join the academic field 8 years ago. As a nurse clinical instructor, and being a clinical nurse instructor and a bedside nurse, I could pretty see the difference about these two areas that I feel that I would need to further my education in the academic field. Another reason that triggered me to go back to the academic field is the nursing shortage in our country. It is known that for more than 50 years, nursing shortage continues to be a trend in the nursing profession. The U.S. nursing shortage is projected to continue to grow to 260,000 registered nurses by 2025. Also, 495,500 RNs will retire or leave the workforce, resulting in a total number of job openings for the RNs of almost 1.2 million by 2020. The nursing shortage and the current changes in the healthcare system pose a great challenge for novice nurses. It is found when nurses leave for another position or retire early, the effects of the hospital's bottom line are significant to the institution, colleagues, and patients. To have a better picture, 1 in 5 nurses leave their first nursing job within 1 year of hire. This alarming statistics motivates me to pursue avenues that will alleviate the nursing shortage and issues affecting the healthcare system. Before, I have seen these statistics and I have personally witnessed and experienced the nurse struggles, what a new nurse have to deal with, and the challenges in the nursing profession. So my goal professionally is to achieve a master's degree in education and possibly getting a PhD in a not so distant future. Initially, I was satisfied just being a bedside nurse. I have assumed the clinical coordinator role, but I have more satisfaction being a bedside nurse and a nurse preceptor for new nurses. It seems my calling was to teach and mold new nurses into the nursing profession. When I realized that is when I decided to become a clinical instructor. And for the past 8 years, it had been a fulfilling achievement in affecting one's future and to serve as an inspiration and tool for student nurses to be successful. Moreover, now being in a master's program of nursing in education, I feel that I'm ready to face the task of serving a higher number of nursing students, to have them be prepared and grow in the field of nursing profession. Initially, acting as a preceptor and mentor to new nurses had played a role for me in helping these new nurses in transitioning to the nursing workforce. This role is considered to be an important part of educating nurses in the healthcare organization. I intend to create an impact in preparing our new generation of nurses of how to be resilient in working in a high-risk work environment of nursing. As a nurse educator, I can lead and teach student nurses how to develop coping strategies that would help them in dealing with high-stress situation of our profession. I intend to instill optimism, hope, self-efficacy, and flexibility in the academic and clinical setting that will be part of the characteristic of students that would further assist them in developing appropriate problem-solving skills and critical thinking. Nursing should not be too serious and should incorporate humor in our profession, but not in the expense of our patients. Use of humor can help nurses manage stressful situations. It could help mitigate circumstances that making them so stressful and unable to think properly. By using humor, it would help them relieve the stress and able to focus their minds so they'll be able to choose the right intervention and to impact patient care. Being a bedside nurse and a clinical nursing instructor, I plan to be a nurse educator in the academic setting. This transition from bedside to clinical teaching and the classroom setting would give me the opportunity to affect more lives through my students and hopefully create more impact on the future of our profession, the patients, and the healthcare system. The nursing faculty shortage also persists in the academic setting. The decreasing number of nursing faculty have detrimental implications in the nursing profession and for other areas of healthcare. However, despite the challenges we are facing in the clinical setting and academia, nursing education is still a satisfying way to reach individuals, families, communities, and to influence the healthcare system. Being a nurse educator, I can be a role model in presenting a positive image of the profession clinically and academically. I joined the academic field with the intention of molding and inspiring student nurses to be well prepared in facing the challenges we are facing in the healthcare setting. In preparation for being an academic nurse educator, my experience in the clinical setting and my pursuit of a master's of nursing education will help me achieve my goal. In the United States, educators are expected to have a graduate level academic preparation and advanced expertise in the area of content to be taught. To be effective in my role as an academic nurse educator, I would need to learn curriculum development, teaching strategies, and evaluation methods. Nursing practice is at the heart of the dynamic healthcare system, and the nursing education serves as the foundation of nursing practice. My active employment in the clinical setting keeps me up to date in the clinical setting practice. This will aid in keeping up with the realities of nursing that will be needed in preparing students for their academic and clinical learning. And I intend to be a useful tool for our students in our profession. My 5-year plan as a nurse educator, the first year of acquisition of my Master's of Education in Nursing, I intend to teach in the classroom setting, trying to learn the new role and to navigate this new environment. I would need the support from the institution I'm working for. The plan in the first year is to apply in teaching workshops or gain teaching experience by preceptorship or teaching assistant role. I could achieve teaching assistant role or I could facilitate learning as a teacher if I would do it before I graduate or become an academic nurse educator. I could probably participate in an internship. Also, participating in formal and informal activities, such as taking advantage of faculty development activities, seeking out peer mentors, and taking an active role in learning on how to teach will be the focus of my first year as a teacher. In progression to my academic nurse educator career, enrolling in a PhD program is my next plan, possibly after my third year of acquiring nurse educator degree. I intend to continue to gain confidence through my experience, providing learning to students, empowering students by utilizing effective teaching strategies and practices, and hopefully I will be able to incorporate my own style, personality, and character in inspiring students to be successful and effective learners. In the fifth year and onwards, the focus will be to engage in nursing research that will address issues and present possible solutions in the nursing shortage and improve retention. Research studies that will guide nursing management or healthcare institutions on how to properly address the issue of high turnover in the clinical and academic setting. In self-improvement and continuous quality improvement in the nurse educator role, as a future nurse educator, participating in acquisition of educator competency through postmaster's courses will help me improve my knowledge and skill in teaching. To be successful in teaching, I would need to assume the role of a learner. Effective teaching will require specialization to the curriculum by use of teaching strategies, evaluation methods, and ability to engage in research and scholarly activities. Although the understanding of evidence-based teaching practice remains diverse, evidence-based teaching practice, which is in short EBTP, to pursue improvement in the teaching role, the use of the dynamic system of evidence-based practice teaching will show evidence that it can support, promote, and maintain a new level of knowledge for students in a variety of situations. Another part that would help with the continuous quality improvement in the nurse educator role is the numerous faculty development opportunities that is available from the American Association of Colleges of Nursing and the National League for Nursing. They offer online and face-to-face activities and development conferences with sessions specifically addressing the needs of the new nurse educators, and it would help nurse educators expand in the role of in their role as a teacher and a nurse educator. In conclusion, academic nurse educators are expected to be prepared as educators, researchers, and to have experience in a clinical specialty area. Moreover, I am fortunate to be in the field of clinical practice and as well as in the field of education. To personally see the challenges ahead of me, to have mentors and professors to prepare me to achieve my goal, put me at a great advantage. Knowing the resources available in my own disposal shows me the future I have in becoming a successful and effective academic nurse educator. In pursuing this career, I hope and pray that I will be an effective educator in enhancing educational outcomes and building confidence for nurses that will benefit patients and create a great impact in their care and the improvement of the nursing profession. With the picture that you see, I hope this would reverberate to every nurse that we encounter. It says that it was a nurse who helped me, aided me, saved me, helped me, taught me, and inspired me. These words are true to the form and of our profession, and hopefully we continue to abide by them. This is the end of my presentation. Thank you for listening and have a good day.